Welcome back. Capitalism versus socialism, the new debate. A new Fox News poll this morning reveals how Americans feel about socialism. The results may surprise you. Take a look at these numbers. 36% of Americans think a move towards socialism is a good thing, up from 20% in August of 2012. Joining me right now in a Fox Business Network exclusive is philanthropist and the chairman of the Milken Institute, Michael Milken. I would say you're one of the ultimate capitalists out there. Mike, it's good to see you.
Good to see you.
Thank you so much for joining us.
And I think when you think capitalism, I think about a free enterprise system and the opportunity that people have to succeed. And the promise of America was this American dream, a chance to succeed based on your ability, not your religion, not whether you're a man or a woman, not where you went to school, and even not where you were born. And that opportunity is key for everyone to feel a participation in society. So it's really the free enterprise system. In our country, we have millions and millions of entrepreneurs, as they do in China and around the world, and they're going to create the jobs of the future and the businesses of the future.
Does it surprise you that we're even having this debate once again about socialism? A good op-ed in the Journal this morning, it says, how to argue with a young socialist. And the Journal writes this. In other words, socialism would dramatically increase the government's power and resources while making Americans more dependent on it for goods and necessities, food, clothing, because it's about the government giving everything away for free.
I think the challenge is you have these periods of disruption. Technology and what has changed. Let's just take the media industry. When I first met you a few decades ago,
yes, it was.
You were 15 years old, I was in a meeting with Steve Ross, and we were thinking about, okay, what about the future of a DVD? Well, the storage capabilities, it took 2 DVDs, both sides. Would a person watch a movie where they put a DVD disc in, watch it, get up, turn it over, take it out, put another one in, watch it, turn it over? Well, today, South Korea is projecting that they can download a movie in 1 second.
Wow.
Now, this
1 second.
This same thing occurs in medical. So when I was putting forth this idea, what you eat, how you live, what you drink, etc., lifestyle, exercise, was affecting your health or your microbiome, the answer 25 years ago was prove it. Well, no one can prove it. You couldn't sequence. Computers weren't fast enough, just like data storage. Well, today, 25 years later, for less than $1,000 in an hour, we can sequence your microbiome and we can know how you're being affected. And so health today in many areas, whether it's heart disease, whether it's cancer, the 2 major causes of death, or other diseases, you can alter how your genes are expressed by changing your microbiome, and you can change your microbiome in a short period of time. So we can now measure something that was unmeasurable before. So the first sequencing cost over $1 billion, today $800, and maybe someday it'll be $10. So this data will allow us to dramatically change how every single person's treated with not just precision medicine, measuring your disease and then trying to figure out what works against it, but precision health, seeing how you're living your life, changing what you're eating, the whole food chain, and seeing if that moves you into prevention.
Mike, this is such an important point that you're making, and I want to drill down on it a bit, because 25 years ago, we did map the whole genome, and we learned a lot. We learned that smoking causes cancer. We changed our behavior and smoke less. We learned how diabetes and heart disease can occur, and we changed our diet. We haven't learned as much about the brain. Where are we on Alzheimer's? And tell us what has taken place in terms of all of this in the last 25 years. We're living longer, the longevity trend. Tell us how we got here.
Well, I think you've covered so many areas, Maria. First, people don't realize that the #1 growth engine for the world's economy in the last 200 years has been medical research and public health. So we have doubled life expectancy on the planet in 1 century. In 1900, average life expectancy on the planet was 31 years of age.
Wow.
And 1 in 5 Americans lost their life before 5 years of age. Today, you've moved 5 to 62, 63. And one of the things, when we look at the growth in Asia, has been the dramatic increase in life expectancy from low 40s to mid 70s in just a couple of generations. So That is one factor. We did sequence the genome, and it was done in 2003, completed, but we didn't know, we weren't sequencing microbiomes. And the cost of $1 billion, no one went to the doctor and said, please sequence my cancer or my disease before you treat me. And so today, you know today, for example, that 28% of prostate cancers have a certain mutation, but 90% of all colon cancer has that same mutation. So if you can effectively deal with that mutation in prostate cancer, you're pretty much going to eliminate colon cancer as a cause of death. And so we used to think of all these cancers being different, but now these mutations appear, and it seemed very naive to assume that you'd have a mutation, but it could only go to your breast, or it could only go to your prostate, or your colon. Now we see that, for example, in prostate cancer, the mutations appear in 81 other forms of cancer. So when you solve them for prostate cancer, this mutation, you have solved them for other cancers also.
And we spoke earlier, I was saying what you've done for prostate cancer in terms of forcing the doctors to share the research.
That has now been done in our faster cures for all diseases, and it's amazing what collaboration can do and teamwork.
It really is.